Greetings.
Hello.
Hey, how are you tonight? Thank you for joining the Health Information Management Orientation for Health Profession. We're excited to have you here and to be attending this orientation. This is designed with you all in mind. You can unmute your mics and ask questions. My name is Katina Flagg. I will be the facilitator tonight of the orientation. Um, We're just delighted that you've actually chosen SNU to continue your education and help you advance professionally and academically. So um, we are pretty excited about that. I'll go ahead and get started with the orientation. Some of the things that we will discuss tonight, you'll meet our team. This is our agenda. We'll talk about the program overview of several courses in the program, your academic support and academic and career support. Uh, Talk about the library. We'll learn more about the RHIA prep exam and then our AHIMA course map and AHIMA as a whole. So, our program director for the Health Information Management team is growing. We have our program director is Dr. Lynn Ward, uh, clinical faculty, myself, Katina Flagg. Dr. Andrea Johnson is another clinical faculty in our master's program. I'm actually clinical faculty in the BS program. We have Dr. Shakira Moreland, who's a clinical faculty in our master's program. And then Dr. Carrie Ann Nelson is also clinical faculty in our BS program. So these are the most of the instructors that are on board, and you can reach out to us for support. If you have questions or need points of clarification, if you have a different instructor or faculty member and you need, additional questions answered, feel free to reach out to us. We'll be happy to support you. When we look at our program as a whole, we do have our BS HIM program. Um, this program, we are accredited through KHAM, which is a very aggressive and rigorous accreditation process that enables you to sit for your credentials through the national credentialing organizations like AHIMA. I'm sorry, Sadie, do you have a question or comment?
I don't. I'm trying to figure out what's going on with my audio because I can't hear you until just now, but I'm trying to mute my speaker. So just ignore me.
Okay, no problem. Thank you.
Thank you so much.
I can help mute you. All righty. So, and what happens is here, we are the BS HIM program. Like I said, it's a well-structured program. We did get our accreditation through KHAM, which is our national accreditation organization. And with that accreditation in mind, you can sit for your RHIA through AHIMA, the American Health Information Management Association. Through all of your studies and your PPE, that's your professional practice experience, you'll learn a lot about our technology, that we're using in the industry. You will gain new knowledge with the terminology used, technology and terminology, and then also your professional skills. So later in the presentation, we do have this program where you can use your professional practice experience, our Heart Solutions Lab. We'll talk about that a little bit later down the line. So, but yeah, we have a very robust program. I'm pretty proud of it myself. So I just want to say that. I've worked in the past many places. SNU is pretty dynamic. You've made a great selection in academia to advance your educational platform. When you look at your courses that we offer, this is the course curriculum. As you know, some of these are prerequisites, and then you start getting into your healthcare data quality management, your coding and classification, your pathology and physiology. You have some of that healthcare delivery system, healthcare reimbursement. So you have a very rigorous educational platform. So with that being said, just allocate some time to really dig in. As you know, we are professionals and you're busy and, trying to juggle work-life balance. I mean, how many of you, nothing happened. You had a whole bunch of free time until you enrolled into this program. I know, Greg, right? And then it's like after you enrolled in here, everything started dropping from the ceiling. Like all of the fires started happening. You have to put these fires out. You have things crawling from under the rock that you never thought of. But guess what? Don't be defeated. Tell them, get behind you because you're going to finish this degree. But it's really funny. You like, oh, when you're deciding to go back to school or advance in something, nothing is happening. The moment you sign a document, then everything falls out the sky, right? I know. So wonderful news. So those of you that are in our BS HIM program, we are thrilled to announce that our master's program has also been accredited through KHAM. Woo, 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 woo. This is like really good information. So those of you that are considering advancing into a master's program, you may want to consider talk to our program director about transitioning from your BS HIM to your MS HIM. There are some opportunities there. And as you know now, many years ago, the bachelor's was the highest degree in HIM. But now it's the master's. And I myself have obtained my master's. I'm pretty proud of it because not many organizations offer that are accredited through KHAM offer your master's of science in HIM. So consider, transitioning on into that program. It would be very advantageous of you. And you're already here in this new platform. So reach out to our program director, Dr. Leon Ward. She'll be happy to give you information, or even Dr. Moreland is also a part of our master's program. So either one of those two can help you understand how to navigate and, plan your next steps. When you look for your academic support, here at SNU, we have a wide variety of support systems for you. It can be from meeting with your librarian, from meeting with your academic advisor, meeting with clinical faculty, tutors, or even our program directors are in reach. So no one in this organization is too far away from you to reach them. That's why we provided our email contact information in the Meet the HIM Team slide. These are all stakeholders that are invested in you. We are here to give you the support you need so you could be successful in our program. The one thing many of us students in the past have not used was the Shapiro Library. I really want to take some time and ask you all to really visit that. And before you submit your documents, your papers, go ahead and spend some time with the academic coach. And let me explain to you why I'm advising you to do that. No one on this meeting has any intention on plagiarism. And that's one of the most offensive emails to receive from one of your instructors. Oh, you've plagiarized. Because when you look at that, you're like, oh no, I've done all of my work. And you probably have. But what happens is if it's not properly formatted in the APA format, you will be flagged for plagiarism. So we don't want to send you through the integrity team, because anytime you have a higher percentage of similarity on your Turnitin report, we ought to report you guys, not report, but send your document through our integrity team for them to review. If they review it, they'll give you feedback, and then they'll still punt you over to, get with your academic coach, review the resources in your library. So the one thing I like to do is say, be proactive. Go ahead and spend some time with that academic coach or your tutors before you submit those documents so that you're not on that similarity report at high numbers, and so that you don't get a mark on your academic record for plagiarism, because we know that's not anyone's intent. But it has happened. Even it happened to me when I was in college. And that's how I can tell you, I know it's one of the most offensive emails, because you feel like, at least I did. And then to sometimes you get the option to resubmit and sometimes you do not. And we don't want to take that option off the table where you cannot resubmit. So just do that investment upfront so you can continue to excel and be very successful in your program. Any questions or comments about that? Okay, keep moving. When we look at our career services, career services is here with you in mind. You do see the email. If you have any questions about trying to advance, if you are transitioning from one field into healthcare and you need help with someone restructuring your resume to pull out your current skills and make that transferable to a position that you're trying to gain, use our career services for that. They help you with your job search opportunities, internship. There's some on-demand webinars that are available for you. Even you can get networking opportunities. How many of you have advanced in your career through networking, right? So you have some military resources. Networking is very, very, very important. If you are currently in your BSHIM program, if you want to go ahead and join your local chapter of AHIMA's local chapter, TechSEMA. See, in my area, it's called TechSEMA because I'm from Texas, but some areas it's HIHEMA. If you're in New Mexico, it could be whatever version that is. Wherever you are, join your local chapter and start visiting. If they have those face-to-face meetings, start going to those face-to-face meetings. It's really advantageous of you to join your AHIMA as a student membership because you get a discount. Can everybody say discount? Yes. Can you say discount? You get a discount. So join as a student. When you sit for your national certification exam, you get your student discount and you get the discounted rate on the exam. So can we say discount? I like discounts. Questions or comments?
So, my name is Jessica. So I do have a question about not necessarily career assistance, but I just kind of wanted a little bit of information. So I'm currently a medical coder. I work as a medical coder. I just got my associates in it, and I also wanted to go into health information management. I wanted to know, like, is there a way that how can I connect the two? Because I don't want to completely give up my medical coding and go into health information management. I just want to know how I can, try to do both. What opportunities are out there, if that makes sense.
Did we say opportunity? Did we really ask that question? Did we say how we connect the two? Really? You are already in the right position. Do you not know that medical billing and coding, well, the coding piece is 90% of the organizations is under the HIM wing.
Mm-hmm.
That's within the HIM department. So you've already done like a large part of the work by obtaining your certification, right? You complete the program, you have your CPC, now you want to advance. Do you not know how strong or your resume, your credentials will be when you have either your RHIT and a coding certification or your RHIA and a coding certification? So you can go CPC for outpatient, you could go CPB for billing, you could go CPMA to be a medical auditor along with your RHIT, or you could do your RHIA. The RHIT is if you have a 2-year degree. We have the BS program, which you come out, you sit for your credential, you become RHIA. So you understand your bandwidth in HIM comes from obtaining these credentials. So you finish your degree, you cannot get the credentials without the degree. So you finish your degree, you sit for your national certification, you get your RHIA, you get your CPC, you're a powerhouse. Those credentials accompanied together, layered, that's what the industry is looking for. You now say, I'm a content expert in this area. The RHIT is your Registered Health Information Technician certification. The RHIA is your Registered Health Information Administrator certification. Though that says that you are a content expert in the field. Then you've taken it to the next step and you've gotten your coding certifications. Any coding. Okay, so through AAPC, That's where you get your CPC, your CPB, your COC, your CPMA. And those are all based on your, outpatient side, right? Your CPC is your certified professional coder. Your CPMA is a certified professional medical auditor. Your CPB is a certified professional biller. That's a national accreditation organization that's highly recognized in the HIM arena. In addition to AHIMA. So we have two national certification credentialing organizations in the HIM field. And AHIMA is the other one. So at AHIMA, you could sit for your inpatient coding certification, which is a CCS, and then they have other coding credentials as well. But accompany any coding credential with your RHIA or RHIT, it gives you a very strong resume. So then you segue your way in, okay? And so in a few slides, we'll talk about the career opportunities within HIM. But that was a very good question, Jessica. You're segueing in right now. What do you currently do in your role?
I work for ear, nose, and throat, and I do the medical coding for that.
Okay, so ENT, and do you work in a private doctor's office or you work in a hospital?
It's a hospital clinic, so it's the main hospital in Mississippi, and I work at one of their clinics that's outside of the actual hospital.
Yes. So being that you are already coding and you have experience in that, you have a direct segue into HIM. You just have to go and determine which role in HIM. Because you're on the outpatient side right now. So when you start looking for, let's just say, advancing into the actual hospital, they have ENT on the hospital outpatient coding side. So you can go in and start looking for outpatient coders. You can look in for a supervisor. I'm not sure how many years of experience you have, but once you get your RHIT or RHIA along with that credential, you can start marketing yourself for a supervisor or a manager role. It depends on the years of experience. And then on the coding side, they have coding educators, they have coding auditors, they have coding managers, they have coding directors. So there's a whole career ladder on that side. Once you get your BS HIM, if you don't want to code anymore, you can go into the operation side. You have prep, scan, index. So, I mean, there's endless opportunities. And what people fail to share with you all is when you obtain this degree and you get that RHIA credential, you can work in attorneys' offices, you can work for insurance companies. So you're not just limited to the hospital, whereas that's where we find a lot of stakeholders go, but attorneys have to request records all the time. So they need someone to be an administrator over their record because those are legal documents. So your career, you have a lot of opportunity that you may not have thought about. You don't have a very small scope. And to help you understand, to work with someone in career assistance, to tee up your resume. I mean, this is what we have these career advisors for. You can get that one-on-one guidance. They can help tee your resume up to help you transition and prepare for different roles. Great question.
Thank you so much.
You're welcome. Any other questions, comments? Greg, I see you taking a lot of notes.
I have to. I'm old.
Oh, no, that's called wisdom, right? We're right there
Katina,
together.
I do have a question.
Sure, Sadie.
Sorry, I didn't mean to interrupt.
Mhm.
What is you said you're in Texas, I'm in Texas also. What is the group you mentioned earlier to be a part of?
TXEMA. So that's the local, it's the Texas, AHIMA, right, is our national organization. And within Texas, our group is called TXEMA. What part of Texas are you in?
I'm in Austin.
Okay, so mine is Houston. So mine is TXEMA. Yours may be something else because Dallas is something else, but you can go on the AHIMA website and find your local chapter And once you become a student member, you'll get that, they'll start sending you emails too.
Okay, perfect. Thank you.
So have you gotten your student membership yet? No? Yes?
Oh, sorry, I was muted. I said I don't think so, but I love me a discount.
That's right. Discount. It sounds like something you're getting it free, right? So a lot about this whole citation thing and plagiarism, this is really, it's really big right now. It's always been big, but we're seeing an increase in plagiarism. I'll just be very transparent. And so we're having to redirect students a lot. And it's all has to do with that proper citations, the embodied citations, giving those authors credit for the work that they've done, and even self-plagiarizing. If you've taken a course before, you cannot resubmit that document. You have to redo the whole thing and as new and original assignment, okay? I've had an experience multiple times where it's my work. They don't understand how it's plagiarized. They may have started a course, did not finish it for, family reasons. We're adults, So, and they want to, oh, I've already done that assignment, so I'll just resubmit it. Well, no, you have to redo a whole new assignment. You cannot do that. So pay attention. Please pull out your APA guidelines. Reference those guidelines. Make sure you're actually doing that formatting properly so that you do not have to redo anything. Who has time to redo work? If you have time to redo work, raise your hand. I didn't think so. No hands got raised. So we're going to spend some time. We're going to invest in that APA formatting and, just to maximize our educational outcomes and not redo work. And most instructors will give you an opportunity to resubmit, but really you don't have time to redo that. So just let's get it right the first time. Spend that time with that academic coach or, with a tutor or something to make sure that we don't miss the mark, right? So for those writing resources and tips, you can visit our SNU Academic Honesty Policy, our Citing and Resources Guide, Facts on Citing, and then also you can visit the Purdue Online Writing Center. And in addition to that, we have our tutors and coaches here within our organization. We have a strong system designed for your success. So if there's anything that we can do here, at SNU, we will be happy to support you and make sure that you get over the hump and that you are successful. So our online library. We have a librarian here that's available if you want to schedule an appointment with her. You have the number here. You can call the librarian or you can send an email for questions. Within that library, we have over 250 databases, so there's a lot of content. New content when you are, writing your papers, because this is 2024. So generally you want to use some content that's from 2020 and above. Anything beyond, past 2020 is pretty much dated at this point. Really, you can start transitioning to year 2021 to 2024 because things have changed. We have new data. And the reason we can go back to 2021 is generally it sometimes take about 3 years to get articles published, and you want to use published articles. Okay? That's what you want to use. So it usually takes some time to get that work, but that data is still accurate. Let me speed up. We have 5 minutes left. All right, so you can reserve some study time on the library. You just go there and you do reserve study time, and you can get time with the librarian or someone to assist you. Very, very beneficial opportunity there. Now the wonderful, excuse me, RHIA exam. Woo. Please do not wait. Do you all know you can qualify to take this exam while you're still actively enrolled? If you are interested, you can reach out to our program director. We have a new ServiceNow ticket that we can give you a link so that you can register for to request the early access to your test. Please do not wait to sit for your certification exam. This is life altering. You can, in most organizations, you cannot be a supervisor, a manager, or director, executive director without this credential. So if you are sitting here doing the work every day, take that extra time, go ahead and test early. Early testing is the key. The longer you wait, the longer you will not have it. And the higher you go up in your position, you know you in school, you want more compensation, you open the doors for a larger compensation opportunity. So the RHI exam, you need 300 points out of the 400 points. Once you register for it, you have 120 days to sit for the national certification exam. Okay, so when we talked about the HEMA career ladder, we talked about various positions on this career map. Okay, so you have, with your credentials, you have revenue cycle positions, you have positions in privacy and risk, informatics, data analysis, consumer HI, and data quality. All of the positions in the gold diamond are emerging. A chief data officer, and you can go out to the AHIMA website and look at this map in your free time. Data governance manager, chief health informatics officer. So these are STEM positions. Health information project analyst, data quality analyst, clinical informatics specialist, decision support, and so on. Even having your RHIA, your coding credentials, EPIC is also a big EHR. It affords you opportunity to, look at some of those positions. So your scope is very broad. As you see, there's a lot of opportunity here. Take time and go out and review this career map on the AHIMA website in your spare time. So, to be successful, always log in early, review your assignments, practice great time management. Like you didn't have anything going on until you started this program. Now you have everything going on. So let's see how we can scale those fires and put those fires out. One of the big things, let's make sure that we understand our due dates. Look at that APA formatting, and just reach out to anyone that, within our organization that can help support you and be successful. Be respectful to your peers and your faculty members, especially in the discussion forums. One thing that I did complete online education just like you are, and I did gain several friends. And I gained those friends not through projects, but through discussions, because generally you start responding to the same person. At least I did. We were like in a cohort, and we were in the courses together, and I started responding to that same person all the time. And we end up being friends, and we start working on different projects together. And we still are friends today. So it depends, just because you are in an online platform doesn't mean you are alone. You are not alone. So you can do a buddy thing, and that can help you be successful as well. Okay. So just learning to navigate, your course menu to find your assignments, look at your announcements, your learning modules, the discussions, and your grades. Just make sure that you get your assignment submitted each week on Sunday. Know that the instructor has until the following week to grade, but generally, we all grade early. We don't wait to the last minute because that's a lot of grading, right? So finding your assignments, just going to your course menu, scrolling through there. And as you see, even on this page, you see the library is right in that course menu function, is right on that toolbar. Everything you need is here, your tools. So just get familiar with the learning module so that you can be successful. If you have an EHR Go assignment, just make sure that you follow those instructions. It will also be under your assignments under EHR Go. So there's some information in submitting those assignments as well. All of the instructions are embedded. Please make sure you look at your rubrics to make sure that you're following that appropriately, especially when you're working on your papers to make sure that you have all of those areas completed within that rubric. It will be very advantageous for you to review that before you make a submission, and you just make sure that you've met that criteria. Any questions or comments? No. Okay. So here's the rubric. As you see, it gives you your values. It tells you what you need to be proficient, what needs improvement, and if it's not evident. One thing I like to tell you is if you're getting data from somewhere, give those stakeholders credit, but you should always include some type of data, graphs, reference. I don't care if you've worked in the industry for 100 years, you're not a content expert, please reference material. You should not write a paper or submit any document at this level without a reference. A good document has at least 3 references that's credible references. Wikipedia is not credible. Do not use Wikipedia in collegiate documents. And these were just some of the references that we used to create this slide deck. And I think 2 minutes over, but I got it all in. Thank you for attending. If you have any questions, please feel free to dialogue with me now. If you don't, you're free to go, but I'll hang back for a couple of seconds just in case you do. Well, thank you for being a part of our SNU family. We really appreciate you and know we're here to continue supporting you and your academic success. If nothing else, thank you all and have a great night. Thank you.
So I do have another question. What can be done with Epic? I work with Epic, and I know